السلام عليكم. بسم الله نبدأ. موضوعنا اليوم Genetics and Metabolism. طبعا هاي الأسبوع الأخير وموضوع اسمه تفرقات، فهاي المواضيع بالعادة الناس ممكن أنا ما تعطيها بال كبير عشانها آخر مواضيع في الأسبوع أو إنها ما بيجي منها نسبة كبيرة، بس في هذا الأسبوع هي مجمعة يعني فحيكون أسهل إنك توصلها وهيك، فدائما أفضل إنك تراجعها. المواضيع سهلة ومش متعمقة كثير، فحنبدأ في أول موضوع اللي هو بسم الله. أوكي، أول سؤال. A 5-day-old female newborn is brought to the hospital because of lethargy, vomiting, poor feeding, and diarrhea for 2 days. She was born at 39 weeks gestation. Vital signs are within normal limits. Bilateral cataracts and icterus are present. Examination shows jaundice of the skin and enlarged liver. Serum glucose is increased. What is the most accurate diagnostic tool? Okay. هلا احنا حنشوف كيف بدنا نحل سوا واحنا قاعدين نقرأ مع بعض. Okay. So some people say C. Let's see. We will now discuss and see why it's C or why it's not C. Okay. So our first topic is about galactosemia. Let's go to overview and clinical features. Usually, galactosemia, how I memorize it, is that galactose and lactosemia. So inability to digest galactose and lactose. Okay, you can remember this way. حيكون كثير أسهل عليكم. وفي لها 3 أنواع. أنا بذكرها بطريقة بحكي جملة يا غالي الغلط غلطك. GALE, GALT, and GALK. The most severe form هو هذا GALT. Okay. هلا في الكلينيكال فيشر حيكون في هيباتوميجالي، poor feeding, liver and kidney failure. ممكن نسأل ليش حيكون في هيباتوميجالي أو poor feeding. بكل بساطة الميتابوليزم happens where in the liver. So when there is a problem in metabolism, so this thing will affect the liver and it will affect feeding because this in itself is material to be eaten and material to be digested, and in the long term it can cause liver failure, and this processes will go to the kidney to be cleaned from the body. When it accumulates in the kidney it will cause kidney failure too. وفي jaundice, but this type usually أو الجندس في العادة بيحصل في الكلاسيك type اللي هو إيش GALT أو the most severe form. Okay. Sometimes also cataract happen. and في الاختبار ال SMLE بالعادة بيجيبوا بالسيناريو كاتاراكت ويجيبوا بعدين أعراض ثانية، فدائما الكاتاراكت هاي كتير مهم إنه تفهموها أو تحفظوها. وفي failure to thrive of course because the body isn't taking enough ingredients. وزي ما حكينا lactose and galactose intolerance. تمام. المرض اسمه galactosemia، فليش lactose also؟ الجواب كتير بسيط. لو تشوفوا هنا هاي الطاولة، اللاكتوز عبارة عن سكرين، سكر جلوكوز وسكر جلاكتوز. فلما يصير في الجسم ويصير في هضم، اللاكتوز لما يتفكك حيصير في عندنا جلوكوز وجلاكتوز، والجلاكتوز هو نفسه اللي مش هينهضم كويس، فاللاكتوز بيتفكك ويصير جلاكتوز ومش هينهضم كويس. فزي ما قلنا قبل نفهمها بهذه الطريقة: galactosemia, galactose and lactosemia or intolerance. تمام. وفي حيصير هايبوغلايسيميا برضه. ليش؟ لأنه في بالميكانيزم of action هي حيكون في مشكلة بالجلاكتوز 1 فوسفات، حيمنع الجلوكوز بشكل عام إنه يصير active form. أوكي؟ لما يمنع يصير active form حيصير في هايبوغلايسيميا. يعني even though في سكر بس مش حيتحول للصيغة اللي إحنا بدنا نستخدمها فيه. تمام؟ complications حيكون في سكر في الجسم والسكر بيتغذى عليه البكتيريا، فالبكتيريا الفريندلي environment أو بيئة خصبة للبكتيريات منها الإيكولاي حيسبب بشكل عام sepsis. و if not treated early, liver and brain damage are irreversible. يعني الليفر أكيد حيتضرر إنه الميتابوليزم بيحصل في الليفر و some metabolites will go to the brain. Okay, and this metabolites will affect the brain. If not treated early enough, this damage will be irreversible. Okay, this is very important information. Okay, هاي كومباريسون بسيطة بين الأنواع. لو تلاحظوا حطينا الأخضر لأخف نوع والأحمر لأسوأ نوع. في شوي حنقول لك مثلا GALE و GALK حيكون asymptomatic أو mild symptoms، بس when there are symptoms just cataract and delayed development. بس in GALT اللي هو most severe form which is actually also the most common، وهذا شيء سيء، يكون في cataract failure to thrive cognitive impairment and bacteriophilic اللي حكيناه من شوي اللي هو sepsis، إنه في increased sugar وفي بيئة كويسة للبكتيريا، وفي cognitive impairment لأنه حيأثر على البرين. الأنواع الثانية يمكن ما تأثر على البرين بشكل أكبر. أكثر شيء الجلط. أوكي زي ما حكيناها مرة ثانية، يا غالي غلط غلطك، أكثر واحدة سيئة الجلط. أوكي تمام. How can we diagnose galactosemia? It should be considered in newborn who presents with jaundice, hepatomegaly, poor feeding, failure to thrive, lethargy, diarrhea or sepsis. أي عرض من هذولا لازم تحصل الديفينيشن تبعها galactosemia، وخاصة مع السيناريو، يعني السيناريو حيوضح لك أكثر. تمام. والبلود تيست حتلاقي increase plasma galactose 1P and galactose low level، كلها هاي metabolites ناتجة عن dehydration or metabolism of galactose. And there will be hemolytic anemia also. Urine analysis you will find حتلاقي increased galactose in urine. galactose حيزيد في اليورين وindigested طبعا. liver function test حيكون أي ماركر طبيعي إنه liver not functioning very well. تلاقي elevated ALT, coagulopathy, increased level of plasma acids. تمام. خاصة هاي الثلاث أنواع. renal function test يكون في metabolic acidosis, galactosuria, glycosuria, amyloidosuria and albuminuria. metabolic acidosis why? because هلا لما يكون عندنا hypoglycemia، فالهايبوغلايسيميا الجسم حيعوضها في انه ينتج ايش؟ كيتون بوديز. الكيتون بوديز are actually acidic so فحيعملنا metabolic acidosis. اوكي هذه مهمة اننا نعرف ليش، لانه hypoglycemic state increase ketone bodies will give us metabolic acidosis. تمام. هلا لما نرجع للسؤال مرة ثانية، حاعطيكم 45 ثانية عشان تشوفوا السؤال كيف حينحل. اوكي وبعدها حنناقشه سوا. اوكي سو الأكثرية جاوبوا US أو ultrasound abdomen. في حدا ممكن يقول لي بالشات ليش جاوبتوا ultrasound abdomen قبل ما نبدأ شرح؟ نستنى 10 ثواني نشوف إذا في حدا بده يحكي ليش حط ultrasound abdomen، ممكن عنده تبرير أو إشي. اوكي طيب الجواب طبعا مش ultrasound abdomen، الجواب حيكون اوكي age of patient. اوكي هلا بنناقش السبب. هلا الالتراساوند اوف abdomen is not the correct answer here. خلينا نقرأ السيناريو مرة ثانية. 5-day-old female newborn brought to the hospital because of lethargy, vomiting, poor feeding, diarrhea for 2 days. 39 weeks يعني term. vital signs normal limits بس في cataracts and icterus are present. يعني في jaundice وفي cataract. حكينا jaundice بيجي مع normal type أو classic presentation، وcataracts بيجي مع هذا المرض بشكل عام. يعني لما يجي هذا الكاتاراكس خاصة في السيناريو و5 days يعني لساتها من شوي مولودة، والجلاكتوز يعني هو نوع من السكر موجود في حليب الأمهات مثلا. ف5 day old يعني على طول إنه أول ما ينولد أول ما يبدأ يتغذى حليب الأم هيبدأ له هذا الأعراض إنه الجلاكتوز موجود في حليب الأم. تمام. وفي كاتاراكت خلاص يعني الدايجنوز صار واضح. هلا الفكرة هنا we will not use this thing in the hospital ولا واحدة من هذول حنطبقها في المستشفى. بس السؤال هنا الهدف منه مش يعرف ان انت ايش حتطبق عن جد، الفكره انه يقول لك الميكانيزم اوف اكشن. بده الواحد يكون فاهم ايش الميكانيزم اوف اكشن. يعني لو قلنا ام ار اي ابدومن MRI، لو متذكرين في اسبوع السيرجري MRI والسي تي سكان ايش خاصه ايش استخداماتهم بتكون بالعاده؟ حد يكتب على الشات. مثلا احنا بنذكر MRI لللوكال تيومرز هاي الشغلات. السي تي ابدومن بالعادة كانت مثلا في سيست أو تيشو مثلا. ألترا ساوند برضه للسيست اللي هي في سيست في الليفر سيست وهاي الشغلات كلها ألترا ساوند. بس هل مثلا هذه المشكلة اللي في الطفل هل في تيشو معين أنت حتشوفه في الليفر أو حتشوفه في أي منطقة معينة أو لا؟ في واحد كتب لك structural imaging. اوكي، بس هل في اشي حتشوفه يعني انت جوا جسم المريض حيقول لك انه هذا والله عنده جلاكتوسيميا؟ في مثلا سيست او تيشو او تيومر او اشي؟ ما في، نو. فالفكرة هنا انه الجواب حيكون liver biopsy. liver biopsy because when you do liver biopsy you will find that this enzyme responsible for metabolism is deficient. بس زي ما قلت لكم هنا، هذا السؤال الهدف منه مش يعرف انت شو بتعمل في المستشفى، الهدف بده اياك تعرف انت فاهم الميكانيزم اكشن ولا لا. تمام، فالجواب حيكون liver biopsy. اوكي، حكينا ام ار اي وسي تي سكان للسوفت تيشو، والالترا ساوند ممكن للسيست، خاصه الليفر ابسس والسيست وهي الشغلات. الليفر biopsy اذا في باثولوجي بس it's not a tissue, not tumor, not anything else. يعني it may be enzyme or metabolic issue. okay, so يعني the problem is in metabolism, not a tumor or anything else. تمام، نروح للموضوع الثاني، نقرأ السؤال سوا. 6-year-old female baby presented to the GP with jaundice, vomiting and poor feeding in the last 5 days. She has had diarrhea since 3 days, looks weak, exhausted. Examination shows jaundice of the skin and conjunctiva. Bilateral cataracts are present. Abdomen is tender with evidence of hepatomegaly. What is the most important recommendation to improve the quality of life of this patient? اوكي، استنى شوي نشوف ايش عندكم اجوبه. ممكن يكون عندكم كلو اوريدي انه ناقشنا شوي الموضوع، فنشوف اذا عندكم جواب احكوا على الشات. اوكي، الاجوبه كويسه سو فار. تمام، في 3 حطوا لنا بي. تمام، هنروح تحت هلا نشوف الفكره. elimination management of galactosemia. بدنا نعالج galactosemia، في دواء معين بنعطيه؟ لا، بس بنقدر نتخلص من الجلاكتوز واللاكتوز in the diet، بدنا نقللهم قدر الامكان. بشكل عام البريست ميلك اللي حكيناه هو موجود فيه السكر والجلاكتوز، فنعطي بدائل صناعيه، في بدائل مثلا بيكون مكتوب عليها لاكتوز فري زي ابتاميل او نيورولاك واي شغلات موجوده في الصيدليات هنا. so we'll give them those substracts and بس يكبروا شويه ممكن نعطيهم soy based diet. هاي في شغلات مثلا فيها soy food sets، هاي شغلات كلها تحطها لو حدا بده يزيد اطلاعوا عليها. تمام، فالجواب كان صح عليكم. stop milk feeding. اوكي، نروح لثالث موضوع. Let's read this question together. A 2-days-old infant presented the signs of low oral intake and his parents told you about his low activity and fever. Upon investigation, you found ketonuria and a characteristic smell of urine. What is the most appropriate diagnosis? فكروا فيها شوية وبعدين ننتقل. اوكي، في واحد بيسأل السؤال الماضي، اعتقد the patient is 6 months not 6 years right؟ الجواب صح، 6 months يعني هو مش 6 years not yet. اوكي، خلينا نكمل هنا. في ناس بلشوا يجاوبوا ايه. اوكي، نروح السندروم نفسها. Marple syrup syndrome. It is autosomal recessive disease. هلا later on بالبرزنتيشن حنفهم ايش autosomal recessive مقصودنا فيه بالضبط. الفكرة هنا في الماربل سيروم syndrome results from lack of enzyme that is responsible for metabolizing VIL amino acids. مختصرها أنا VIL بس هي valine, isoleucine and leucine. Symptoms and signs: feeding intolerance. في 3 امينو اسيد انت مش قادر تستخدمهم، فاكيد حيكون عندك feeding intolerance failure to thrive، وممكن بس تستخدمهم مثلا او تاكلهم حيصير في عندك vomiting وليثارجي. هلا العلامه الفارقه انه ليش سموه ماربل سيروب syndrome؟ simply because there is marble syrup powder in urine، وهي ناتجة عن isoleucine metabolites اللي هو هذا بالضبط. تمام. It may progress to irreversible mental retardation, hyperactivity, severe failure to thrive, seizures, coma, cerebral edema and death. irreversible mental retardation زي ما قلنا metabolites حتضلها موجودة مش هنقدر نطلعها، فهذا حيتكون في الليفر وفي البرين وبعدين حتى يسبب كدني فيلير كمان. تمام، روح تحت. تمام. So diagnostic features. هلا احنا بدنا نشخص المرض. It is usually part of newborn screening. اوكي. بالفيزيكال اكزامينيشن يعني انت بالعاده حتفحص هذا مع اي مولود جديد من ولد، حتفحص المرض هذا. فيزيكال بشكل عام حيكون في sweet smelling urine، على طول انت حتعرف انه في sweet smelling urine، حتشيك في ماربل سيروب سيندروم، اللي هو اذا حدا بيعرف البانكيك او بياكل البانكيك بالعاده حيشوف انه بيشبه ريحه هذا الشيء اللي هو احنا بنسميه خط القيقب، وبنحط على البانكيك. تمام. حيكون في، هلا احنا بنحكي بالسيرم، حيكون في increased level of alpha keto acids or BCAA especially leucine alpha keto acids، وهذه هي ميتابولايت ناتجه عن الفيل امينو اسيدز. اوكي، حتكون زايده، فهذا دليل انه في بروبلم في هذول الامينو اسيدز. اوكي، increased level leucine isoleucine الفالين زي ما حكينا، وهايبوغلايسيميا. هايبوغلايسيميا لنفس السبب تبع الجلاكتوسيميا. تمام، يعني هيكون في مشكله في الترانسفير انتو اكتيف فورم لنفس السبب، حيمنع انه السكر يصير صيغه فعاله، وحيصير في كيتون بوديز مش عارف شو، وحيصير ميتابوليك اسيدوز نفس الفكره. اوكي، اختبار في اليورين organic acid analysis presence of abnormal branch chain hydrox and keto acids، نفس الفكره اللي هنا metabolites of this amino acids. treatment simply avoid foods containing BCAA او الميتابولايت تبعت الفيل امينو اسيد. supplementation with thiamine and liver transplantation because later on او بالمستقبل حتحس انه او ممكن في ناس يكون عندهم irreversible disease او يعني الديزيز تبعهم progressed badly، فهيحتاجوا liver transplantation. اوكي، المايك احسن هلا هيك؟ ثانية في الباند ممكن نظبط المايك احسن هيك يا شباب؟ اوكي، هلا السؤال هذا عشان نجاوب عليه نشوف شو جواب الأغلبية. اوكي، 30 واحد ماربل سيروب سندروم. اوكي صح، في ناس بس حطوا جلاكتوسيميا. ليش حطيتوا جلاكتوسيميا؟ يعني احنا متذكرين حكينا انه في الجلاكتوسيميا بالعاده حتلاقي كاتاراكت وما حيكون في كاركترستكس مال اوفيورين. هنا ماربل سيروب سندروم يعني على اسمها في كاركترستكس مال اوفيورين، تمام، وما في كاتاراكت، فعلى طول المفروض نفكر في ماربل سيروب سندروم. اوكي، الجواب صح. تمام، نروح لرابع موضوع، نقرأ السؤال مع بعض. A 20-year-old male patient came to Bawadi hospital with growth retardation. Weakness and bone pain. Examination revealed splenomegaly and pancytopenia. Bone biopsy showed cells with crickled paper-like cytoplasm. The diagnosis you are thinking of is okay. خلينا نشوف هلا disease. This is Gaucher disease. This is autosomal recessive disease. It is an error of metabolism also in the liver يعني. That affects recycling of cellular glycolipids GBA. Why glycolipids are important. هذا سؤال عام يعني المفروض إن أي طالب ممكن يجاوبه. وين glycolipids are important. وين بالضبط الجلايكوليبيدز مهمة. أي حد عنده فكرة بالشات؟ أوكي، عشان الوقت بس، فالجلايكوليبيدز مهمة بشكل عام بأي خلية يكون الغلاف الخارجي تبعها جلايكوليبيدز، صح ولا لا؟ فيعني كوشر ديزيز بشكل عام حيأثر على كل خلايا الجسم. تمام. GBA is recycled normally by macrophages as it decreases all RBCs. In disease people, GBA metabolizing enzyme is lacking. يعني حيكون في تنقية لل GBA metabolite من الماكروفاج. Sometimes الإنزيم اللي بيطهر ال GBA ناقص. ال GBA حتتكون في الماكروفاج، حتتكون فيها وحتسبب مظهر حنشوف احنا هلا كمان شوي. تمام. وهاي السيلز بالاخر اللي هي حتصير ديزيز سيلز، ديزيز ماكروفاجز، حنسميها جوشر سيلز. وهذه الجوشر سيلز حتتكون في السبلين والليفر والبون مارو. طيب بشكل عام لما نحكي عن هاي الشغلات can you guess what would that cause؟ حكينا في السبلين مثلا، نعطيكم اياها بشكل سريع. السبلين حيكون في سبلينوميجالي، في الليفر حيكون هيباتوميجالي، في البون مارو شو حيعمل؟ اوكي، في جواب بيحكي بانسايتوبينيا. اوكي this is good، وجوابك صح، بانسايتوبينيا. الاكوميليشن اوف جوشر سيلز حيضغط على البون مارو وحيسبب بانسايتوبينيا. البون مارو نفسه مش حيقدر حيصير مضغوط ومش حيقدر ينزل سيلز، فيصير في بانسايتوبينيا. اوكي. and Gaucher cells in addition to that will produce inflammatory cytokines that will lead to the rest of symptoms اللي هنشوفها هنا هلا. symptoms عندنا بون بين. البون بين غالبا انه بيجي في البون مارو، حيسبب بون بين. في هيباتوميجالي وسبينوميجالي اللي تكلمنا عنها من شوي. في انيميا، انه حيكون في نقص في كريات الدم بشكل عام، وثرومبوسايتوبينيا، اوستيوبينيا، وبون مارو انفلتريشن اللي حكينا عنها. جنرال سيمبتومز يكون في easy bruising and bleeding، انه في نقص في الثرومبوسايتوبينيا، وفي delayed pubertal development، في growth retardation. تمام. هلا let's look into this picture together. Left is a classic appearance of Gaucher cells. ذكرني Gaucher cells حكينا عليها من شوي. It's macrophages and it will digest GBA، بس اللايزوزوم او الانزيم مسؤول عن digestion of GBA is not functioning, so the GBAs instead of being lysed will accumulate in the macrophages, causing this characteristic appearance. And then the macrophage with time it will explode and giving us this crumpled tissue papers، او يعني بعيد عنكم ورقه فاين، يعني شكل ورقه فاين. تمام. وهي المنظر هذا معناه هيباتوميجالي. تمام. abdomen enlargement to the liver and spleen enlargement. اوكي. سو هاي الصوره خلوها ببالكم دائما، crumpled tissue papers. تمام. نروح للdiagnosis. How do we diagnose this disease? Enzyme study called BGL, beta glucoside blood test to find the lacking enzyme. Yani you will study the enzyme that is lacking. You will see is this enzyme available or not. And you will do not ultrasound, not MRI, not CT scan. You will go into checking the liver enzymes because this is a metabolic problem. Okay. You can study the mutation in the gene that is responsible for GBA enzyme, digestion enzyme. You can check the bone marrow. You will find in the bone marrow, as we said, Gaucher cells will accumulate in the bone marrow. So you can actually see Gaucher cells there, and you will find their characteristic appearance. You will see their characteristic appearance, which is crumpled tissue paper. Okay. Treatment, enzyme therapy, GBA. You will give this enzyme back to the infected people. You can give osteoporosis drugs for bone damage and supportive therapy. Okay, so if we go to this question again, can you answer? What do you think is the answer? Okay, Gaucher disease. في ناس كتبوا alkatiniuria. Okay, but the majority answered Gaucher disease, which is good. It's Gaucher disease, of course. They said bone biopsy showed cells with clinical paper-like cytoplasm. It's typical appearance اللي حكينا عنه من شوي. وفي سبينوميجالي وفي بانسايتوبينيا. بانسايتوبينيا حكينا ليش؟ حكينا عشان infiltration of bone marrow. Okay. And this is the appearance. Okay. اللي تحته. Can you okay, let's read this question together. A 7-month-old baby girl presented with tremors, vomiting, and yellowish discoloration for 1 week. She was exclusively breastfeeding. 1 week ago, her mother started introducing fruit and fruit juice. Since then, the baby became irritable and presented all mentioned symptoms. On examination, there was enlarged spleen and liver generalized jaundice. Urine analysis showed positive reducing substances. What is the most appropriate diagnosis? أهم نقطة هنا. Her mother started introducing fruit and the fruit juice 1 week ago. Okay. 10 seconds and we will move to explaining this. Okay, already answers are emerging. Okay. So, disorder of fructose metabolism, overview and clinical features. This disease also is autosomal recessive. We have 3 variants. We have F1P, FK, and F16P. And as usual, green is good, red is bad, yellow is average or moderate, let's say. This type are healthy until they ingest fructose. Tamam? In this first type. Second type, usually there are no symptoms. Okay, asymptomatic and diagnosed accidentally when non-glucose reducing substance is detected in urine. Okay, so this one, the green one, asymptomatic, you even will diagnose it by chance. This one, F1P, you will feel it after you ingest fructose, otherwise you are healthy. F16P, however, can be fatal in units. يعني from the beginning there will be fatality in units. يعني clinical presentation, abdominal pain because you cannot tolerate fructose, so you will have osmotic diarrhea and stuff, abdominal pain, nausea, sweating, you will vomit, you might have hypoglycemia, same mechanism we explained earlier. We'll have confusion, seizures, coma. A prolonged ingestion may cause cirrhosis because it is metabolic activities. So if it's not working in the liver, it can cause cirrhosis. Mental deterioration, the metabolites in the brain, and proximal renal tubular acidosis because clearance through the kidney. Age of onset, F1P start as soon as the child starts consuming sucrose. As we said, F1P, when you start consuming sucrose or fructose, you will feel this. F16P, early in life and fatal. FK, by chance you diagnose it, usually asymptomatic. So back to the question. Okay, the majority answered congenital fructose intolerance. Excellent. Our clue was, as we said, she was exclusively breastfeeding, but 1 week ago, the mother started introducing fruit and fruit juice. Since then, the symptoms started, okay? So this is our clue. And this is congenital fructose intolerance. Excellent, excellent, guys. So let's go to the next topic. A 28-year-old man comes to the physician for the evaluation of progressively worsening tremor in his hands and multiple falls over the past 3 months. The tremor occurs both at rest and with movement. He also reported decreased concentration and the loss of interest in his normal activities over time period. He has no history of serious medical illness and takes no medications. He drinks 2 alcoholic beverages daily and does not use illicit drugs. Vital signs are within normal limits, but he has elevated LFT, liver function test, abnormal. Physical exam shows mild jaundice, flapping tremor, and a broad-based Gaucher-Fleischer rings on slit lamp examination. What is the diagnosis? Okay, already answers are emerging. When you read this question, I want you to note one thing, that this man is also alcoholic. Okay, it will not alter the answer now, but I will tell you something about it later on. Okay, so let's discuss Wilson disease. Wilson disease is a rare genetic disorder characterized by excess copper stored in various body tissues, particularly liver, brain, corneas of the eyes. The disease is progressive, and if left untreated, it may cause liver disease, central nervous system dysfunction, and death. So, when we go to clinical features or symptoms, there is Gaucher-Fleischer ring, which is copper in cornea. You will see it here around the cornea, but not inside, so around it. Neurological symptoms like tremors, emotion problems, difficulty with handwriting, Parkinsonism, dysarthria, and liver failure, starting by hepatomegaly, ascites, and variceal bleeding. Okay, it can cause neurological symptoms. Does anyone watch Dr. House? Just simply write Y if you do in the chat, just very quickly. I will tell you something that is very beneficial in your life. Someone said yes, exactly, good. So, does anyone remember this episode specifically? Okay, good. So people are remembering this episode. This woman actually, if you remember the symptoms that we just spoke about, and you remember this woman, which has Gaucher-Fleischer ring, she didn't have those same symptoms. She had something different. Does anyone know what was that symptoms? Indicative of what, at least? It was a little bit different. It was not liver failure. It was not hepatomegaly. It was different. And this actually is very important. It is life-saving. Safa Sharif, psycho symptoms, exactly. Intelligent. Okay. So she came with psychiatric symptoms, and this is common with Wilson disease, and this is very problematic. أنا لما كنت أحضر برزنتيشن مريت على بحثين. أول بحث بيحكي إنه في ناس، واحد كان عنده ويلسون ديزيز وهو كان الكحوليك في نفس الوقت. فما شخصوه في ويلسون ديزيز، شخصوه الكهوليك ليفر ديزيز وما تعالج كويس. تمام. والديزيز از بروجريسيف، يعني الزلمه خسر كثير من mental function تبعه because it's progressive and they misdiagnosed him. And another more important scenario I saw was a man who was diagnosed as schizophrenic for 10 years until they discovered no, actually he has Wilson disease. 10 years he was thought to be schizophrenic and he had symptoms of schizophrenia, not any psychiatric disease, schizophrenia. The thing here, this thing can save lives because usually when there is neurological symptoms, Gaucher ring are always present. So usually some symptoms may be present like hepatomegaly and stuff, but no neurological symptoms. But then Gaucher ring is not very indicative. But when there is KF ring, always there is neurological symptoms. Okay. So if someone has psychiatric symptoms and you expect something else, another presentation, you will look into his eyes, you will see Gaucher ring, and then you will indicate, oh, actually this is not psychiatric problem, this is Wilson disease. Okay, this is very important and this is life-saving in the future. Okay, so this question, let's see what you will answer about it, guys. 100% answered Wilson disease. Exactly, guys. Thank you very much. Very good. Someone is asking which episode. I don't know exactly which episode, but it's there. You can find it. Try to search Google for Wilson disease house. Maybe you'll find the episode. Okay. So let's go to the next topic. This question. A 30-year-old woman presenting with progressive difficulty walking, slow speech, and tremor for the past 9 months. She is not alcoholic drinker. Her speech was slurred. Findings on examination, tremor of her right hand, and the broad-based gait. On abdominal examination, she has hepatosplenomegaly and KF rings on slit limb examination. What is the next appropriate investigation? Okay, 10 seconds, try to answer. Okay, already some people are answering. Excellent. Okay, so let's go into the next slide. Wilson disease, diagnostic test. We have slit limb examination. We have KF rings, which is the best initial test. Best initial test, especially if there is neurological symptoms. Especially if there is neurological symptoms. Blood test, we'll see increased transaminases, which indicate general liver problem. You will have Coombs negative hemolytic anemia, thrombocytopenia, and increase in level of free serum copper. Okay, but on the opposite side, decrease in total serum copper. So the free serum and in the serum, there will be free copper, okay, but there is no binding of copper, okay? And there will be increased urine copper excretion over 24 hours. So the examination usually done is urine copper excretion over 24 hours. This examination will detect copper in the urine. Sometimes if this examination is not enough or it's not indicated, we'll go to liver biopsy to confirm, okay? And if other tests didn't help diagnosing this condition. Otherwise, if you suspect that this patient having neurological problems, as we said, you remember the psychiatric stuff that we talk about, sometimes you want to check if it's because of Wilson disease, you will do cranial MRI, you will see copper accumulation in the betamin, thalamus, and brainstem, leading to hyperintensities in these areas. So you know, oh, actually copper is invading these areas and it's causing symptoms, okay? So let's see what you'll answer for this question as we pass it again. 100% 24-hour urine copper. Exactly, guys. Good. So let's go to the next question. So see 24 hours later, and this is just general information for you. Slit limb examination, you will find KF rings. This is the best initial test, but the best confirmatory or definitive diagnosis is through liver biopsy because this is metabolic problem. Okay, let's go to the next topic. 28-year-old man came with hand tremor. And when he wakes up in the morning, his pillow is soaked with saliva. He is unable to concentrate. On examination, he has broad-based gait. A photograph of the patient's right eye is provided. What is the management? Okay. Okay, good. There are some thoughts about the treatment here. So let's go into it in details. So management of Wilson disease, general management. This is what we'll do for all patients. Low copper diet. We will avoid foods that contain copper, like organic meat, shellfish, nuts, and chocolate. We'll make regular checkups, especially if the disease is stable, every 6 months. So regular checkups for liver biochemical tests every 6 months if the patient is stable. And if the patient is having now a fulminant liver failure, or it's progressively going worse, we can consider liver transplantation. For medical therapy, we can give chelating agents, which includes penicillamine and zinc salts and trinitine. Okay, chelating agents, most common version or the best one, first line penicillamine. Maintenance therapy will give zinc salts or low dose chelating agents to maintain. So for the episodes, chelating agents. To maintain, we'll give low dose of chelating agents or zinc salts. This is enough. So let's go to the question again and see how we will answer. Okay, so most people choose penicillamine and some people choose prednisone. Prednisone is not the correct answer. Sure, it's penicillamine. A good way to remember this is it looks like penicillin, the pronunciation, penicillamine. So it looks like penicillin, right? So that's an easy way to remember it. And penicillamine is the good answer or the correct answer. Next topic. Now we start to get into hereditary issues or real genetics. Now we were discussing some diseases, and now we will discuss the mechanism of genetics, how genetics works. A child presented with his parents saying that he walks on the tip of his foot. He started to walk at 13 months of age and had a normal development. Lab findings revealed creatine kinase 300. His young brother died with a muscular disease, and the mother is now pregnant with a boy. What is the chance of the brother inheriting the same disease, which is Duchene muscle dystrophy inheritance? Okay, let's see what you will answer here before we proceed. 10 seconds. Okay, B or C. C. Okay. So let's go into this topic. Pedigree reading. Of course, pedigree reading is one of the high yield information, and some people think it's hard, but actually it's pretty easy. So let's try to understand how pedigrees work. If we see a square, this is a male, circle, female. If a female and the male are partnering or they are becoming a couple, married couple, they will be mating. So we will have this link. Now, if they are having children, we will have another link like this. As you can see, they have children now, one female and one male. Okay, what if their children were twins? It would be either dizygotic or monozygotic. So dizygotic twins, they have two placentas and two amniotic sacs, so they are kind of different. So we don't have so many links. But if they are monozygotic twins, we'll have this extra link. If the female is pregnant, maybe the first month, you don't know what is the gender of the baby or the fetus, you will have this sign, 6 unspecified. Okay. And if you have it colored, it means this is affected individual. إذا كانت ملونة معناها الطفل مصاب. إذا كانت نص ملونة معناها حامل الصفة أو trait. Okay. This sign means death. هاي الساين معناها 6 linked. هنا abortion. تمام. هلا لو نروح مثلا لهذا الجدول نحاول نقرأه سوا. This first thing, what does it say? This first generation, what does it say? Can someone write in the chat very quickly? Okay, for time, let's say together. The first generation are married people. Yes, healthy couple, exactly. They are healthy couple, and this line says that they are having children. Okay, and they have one children which is female, and one child is a male. And this male is colored, indicating that this male is, in the chat, diseased, exactly. So this son is diseased. And if you see, he will be married and he'll have a son which is not diseased, but the female, she will get married also, and she will have one male patient, one male child which is affected or diseased, and she will have a twin which is monozygotic or dizygotic. See, there are no two links. What do you think? This is monozygotic or dizygotic? Dizygotic, exactly. And they are not affected. A smart man now can tell what this type of inheritance. But before that, let me actually tell you something. If you see the pedigree reading here, half circle means trait, but sometimes not every pedigree write this. Some people just leave it for you to know. When you read this, you will know, oh, actually, some people are having the trait, but they are not affected. They will not give you this, not always, okay? If they give you this, you're lucky. But if they don't give you, then they will not give you. Okay, X-linked. Okay, good answer. Only male is affected. Okay, let's proceed next. You can practice this later on, but X-link is a good answer. Okay, so the Duchenne muscular dystrophy is our next topic. It is a genetic disorder characterized by progressive muscle degeneration and weakness due to the alteration of protein called dystrophy that help keep muscle cells intact. Okay, so when this genetic enzyme is not here, the muscles will have problem being intact together. A famous sign will be present when the child starts to walk in his first years of life. He will try to climb up himself like this. He will try to climb up, and then he will climb up, but after difficulty, he will try like this. It's called Gaucher sign. Okay. It is X-linked recessive. Only male individuals affected here. Age of onset is usually 2 to 5 years. Why 2 to 5 years? In this age, the children start to work. Okay. So let's go to this question again. As we said, it's excellent. Let's see what you answer, guys. Okay, so the majority answer 50%, but I think there is a little bit misunderstanding because about 10 people answered incorrectly. So let's go into this question. Child presented with his parents saying that he walks on the tip of his foot. He started to walk at 13 months of age and had normal development. He started to walk at 13 months of age and had a normal development. Lab findings weak creatinine, his young brother died. Okay. So can anyone, if of those who answer correctly, try to explain why is this the correct answer? Why is it 50%? It's actually 50%. But can anyone tell us why it's 50%? Exactly, because it's a boy and affect only males. So there's 50% chance that he will be affected of this disease. Exactly. Okay, so next topic. Let's read this question together. 3-year-old boy is brought to a physician because of clumsiness and multiple falls over the past 4 months. He started walking at the age of 18 months and could walk steps by the time he was 27 months. But now, okay, so he started walking good, but then as he struggles to walk without assistance. When standing up from lying position, focus here, he crawls into his knees and slowly walks himself up with his hands. There is bilateral calf enlargement. What is the most likely diagnosis? Let's see your answers. Or, okay, 10 seconds. Let's see, people are already answering. Some people say A and some people say D. Okay, so let's go into this topic. Duchenne muscular dystrophy. As you remember, we already talked about this sign, which is Gaucher's sign. The patient will climb up himself, so he will not be able to stand up by himself easily. He will need assistance. He will use the assistance of his legs to lay up, okay? In clinical features, there is poor balance and lordosis, and you will see something that is very characteristic. This enlarged calf muscles. Actually, it's not actually enlarged. As you see here, it's called pseudo-hypertrophy. Can anyone tell why it's called pseudo-hypertrophy? Let's see if someone can answer this. So why it's called pseudo-hypertrophy. Ayman Salah saying it's not muscles. Excellent, excellent. It's fat and fibrosis. Excellent, guys. Okay, so it's pseudo hypertrophy. It's not muscle. Actually, the muscle is breaking down because of the DMD gene. It's pathogenic here. So the muscles will be breaking down, but because of this breakdown, the body will try to accumulate, and he will replace it with fat and fibrosis. So you will see a huge calf muscles, but then the patient is not able to walk correctly. So come on, you have all this calf muscle and you cannot walk. Actually, it's not muscle. It's just fat and fibrosis. Okay. This is easy to remember. The Duchene signs. G for Gaucher sign, which is this one. The patient climbs up himself. And T for tiptoeing. He will tiptoe himself because his muscles is inefficient to walk very well. Weak muscles, as we said, because of DMD default gene. And cough is a huge pseudo hypertrophy. And lordosis. This is how he will walk. Okay. And waddling gait. Waddling gait is somehow like tiptoeing. Okay. This is the treatment, usually corticosteroid and stuff. We'll talk about it in the next slides in detail. So to diagnose Duchenne muscular dystrophy, blood test usually creatinine kinase is elevated. Creatinine kinase in itself is a product of muscle, so of amino acid. So when amino acid is breaking down or proteins are broken down, we have increased creatinine kinase in serum of almost all affected individuals. Also, more than 50% female carriers. The females have 2X, so they are only carriers. But males usually have 1X and 1Y. So when they have this X, default X, they will have this disease. But females can have 1X default and 1X. That is normal. So they may present with some creatine kinase, okay? But otherwise, asymptomatic. Genetic analysis, which is the confirmatory test, you will detect the DMD gene mutation, dystrophin gene mutation. Muscle biopsy only performed if genetic analysis is inclusive. Findings, the disease course, muscle fiber diameter changes. Later in the disease course, necrosis of muscle tissue and replacement with connective and adipose tissue, which, as we said, the pseudo hypertrophy. And we said there will be absent dystrophin. Treatment, there is medical therapy. We can give glucocorticoids like prednisone and deflazacort. They will slow progression of the disease. And we can give an antisense oligonucleotide that binds to the oxygen RNA prior to splicing, which leads to skipping this exon. So we can give like the DMD gene, a similar or agonist to DMD gene that can help us a little bit here. Okay, it will function like DMD. Okay, so this is genetic solution. It will result in production of truncated but functional dystrophin protein can only use individuals with mutation within the exon 51 of dystrophin gene. Dystrophin gene is not only one problem. It could be a problem in different genes that present the same problem. But exon 51, you can treat it with dystrophin gene. Okay, this is a little bit advanced. The thing is that you can understand that there is genetic solution here, but in some individuals only. Supportive therapy, you will give him physiotherapy to reinforce preserved muscles. So you'll try to enforce and strengthen the preserved muscles that he still has, including respiratory muscle training and prevent contractures. You can give orthopedic assistive devices like wheelchair and walkers. You will support him psychologically. You can have ventilation support because he is losing his muscles. So even the muscles associated with ventilation can be affected later on. Okay, surgical treatment, if necessary, of the contraction or correction of scoliosis. Scoliosis is it's the spine, the problem of the spine. Okay. So if we go back to this question, what do you think the answer is? Let's check what your answer is. Okay, so 32% or 32 people answered this Duchenne muscular dystrophy, and 3 people answered otherwise. If you can see, our clue here is that he started walking very well, but then when the DMD gene started to become defaulty, or when the DMD gene started to transcribe or to try to be needed, Now he will struggle to walk because his muscles will dystrophy. Okay, so he will struggle to walk without assistance. He will have this sign, which we all know. When standing up from lying position, he crawls into his knees and slowly walks himself up with his hands. What is this sign called? Gown syndrome. Gown's sign. There is bilateral calf enlargement, which is pseudo enlargement, and this is the Duchene muscular dystrophy, of course. Okay, that's it. Do you have any question or something we can discuss together in our time? Let's look at the chat. Does anyone have any question in general regarding this? Okay, thank you all. I hope you enjoyed. Don't forget to evaluate me as you thought about me. Thank you very much.